sponsored by Springfield Clinic. For this week's Wellness Wednesday, we're joined by Joe Higert, a lab manager with Springfield Clinic, to discuss DriveUp Labs and COVID-19 testing. Joe, of course, this is a big deal, those DriveUp Labs. Talk about what you guys offer at your facility, in your clinic.
Hey, good morning, Brittany. Thank you so much for having me, first off. Yes, so we do, of course, have our two DriveUp Lab locations going right now. So, of course, through both locations, we offer full service labs. So that's your blood work, your influenza swabs, strep, things like that. So there's really nothing we can't do in terms of lab services and blood draws through both locations. And then, of course, we offer the big ticket item right now, right, is the COVID testing. So we offer a couple different forms of COVID testing at both locations right now.
Is it easy to use the DriveUp Lab facility? Do you just need to check in and then you can see somebody, or how does that process work?
Yeah, we've tried to make it as easy as possible. So we started these in March, so we've had some time to kind of perfect the process and make it the most efficient and easy for patients. So they would both locations work the same way. You pull up to some closed garage doors, and there's a number to call in. So you'll call into our reception staff, and they'll pull your orders and make sure they've got everything you need for the visit. And then we'll lift the garage doors, you'll pull in, somebody will come out to greet you, verify your orders, things like that with you, and we'll get your blood drawn, get your swab taken, and get you on your way. So it's really a very quick process. It takes about 5 to 8 minutes to get a patient in and out.
Oh, that's not long at all, 5 to 8 minutes. Switching gears a little bit to the COVID-19 testing, is it pretty much the same process? Are you guys offering rapid tests? How does that process work?
Sure. Yeah. So we are offering rapid tests, and we do have the instruments in the drive-through location. So it's a very quick test, about a 20-minute turnaround time. Now, of course, those results will go to the patient's, a Springfield Clinic's primary care physician. So it's important to note that for the rapid testing, you do have to have a primary care physician with Springfield Clinic. But we do also offer a 2 to 3 day turnaround time, and that's a send-out test. It's a PCR test, and we will service not only Springfield Clinic patients, but also other organizations in the area for that as well. So you can have an outside provider for a 2 to 3 day turnaround test for COVID-19.
Okay. And Joe, a lot of people don't see what's happening behind the scenes, but you guys are working pretty fast to get those tests, out to people quickly so they can know their results.
Absolutely. Yes. It's been a tremendous team effort. The Springfield Clinic staff has really stepped up, and you're exactly right, Brittany. There's a ton behind the scenes that happen, but our goal is stays behind the scenes, right? We get the patient in and get them on their way quick and easy and keep them safe.
Well, Joe, thank you so much for being with us today. A lot of valuable information.
Absolutely, Brittany. Thank you so much for having me.